Welcome back to Mid Morning. October is Carpal Tunnel Awareness Month.
Joining us today from Bluegrass Orthopaedics is Dr. Victor Marwin to share what you need to know about the symptoms and treatment options. Thank you so much for being here with us today.
Thanks for having me.
So for those who might not know, what is carpal tunnel?
Carpal tunnel syndrome is compression of the median nerve, which is one of the major nerves that causes hand function, through the middle of the wrist, underneath the transverse carpal ligament in your palm. As it gets compressed, it causes numbness and tingling in the fingers, and eventually pain and disability with motor function, problems manipulating fine objects, things like that.
What are some of the most severe symptoms? I guess where do they normally start to notice pain first? How does that work?
The people typically notice pain first in their radial three fingers, or the thumb, index, and middle finger. So these three fingers will typically have numbness and tingling, and then it can progress to pain. And again, that difficulty manipulating fine objects, clumsiness in the hand. That's where patients typically feel it first.
Is there an age that people typically start to get those symptoms?
Typically, kind of late 30s, 40s, 50s is most of my carpal tunnel patients' age.
What kind of treatments do you all offer for people? I mean, is there a way to reverse the effects? Or
oh, absolutely. Yeah, I mean, the mainstay of treatment for early carpal tunnel disease is non-operative treatment with a wrist brace at nighttime. There can be some activity modifications. Sometimes injections play a role, although that's not a good long-term treatment strategy for affecting the ultimate outcome. And then when it progresses beyond those treatment measures, it's surgical.
Is there anything you can do to kind of prevent it?
I mean, the big thing you can do to prevent it is activity modification. So you want to avoid provocative activities, bad mechanics at work, using a computer, using hand tools, lots of wrist flexion. I have a lot of patients that sleep like this underneath their pillow, where their wrist and their elbow is bent. That can compress nerves both in the wrist and the elbow. So really mitigating those activity related positions is very effective in the early stages. And then beyond that, just not ignoring it. So when the symptoms start to progress and they're a little bit more mild to medium, don't ignore it. There can be some changes that happen in the nerve that are long-term and irreversible. So if you're having symptoms, there are treatment options out there that'll get you back to work and activities a lot faster that I specialize in. So I would have you come and see somebody that takes care of carpal tunnel.
How often do you all have people come in and may not even realize that that's what's going on with them?
Very often. Yeah, very often. It's a poorly understood condition. It's, the general public tends to think that, a lot of hand and wrist pain complaints are carpal tunnel because there's misconceptions with the diagnosis, but it's a nerve compression problem that's separate from arthritis or tendon inflammation. Patients can have those problems as well, but it's a separate condition.
And you're at Bluegrass Orthopaedics. Where is that located?
Bluegrass Orthopaedics, our main office is on Richmond Road. So it's right off of Richmond Road, Yorkshire Medical Park, over by Richmond and Manowar. We also have offices in Hamburg. We have offices in Georgetown, down in London and Somerset.
Awesome.
BluegrassOrtho.com. We've got the website right there on screen. Thanks so much for coming and talking to us.
Thanks for having us. Thanks.